Hi, this video is intended as a guide to help you change your patient's PICC dressing. Please note, if you observe any discrepancy from our policy, to follow the policy. This video is only intended as a guideline. Before you get started, please make certain the dressing does need to be changed, and that you've gathered the external length at insertion in EPICC prior to completing this task. First step is to prepare the patient work surface, clearing and disinfecting the space, even using a blue chucks to ensure cleanliness. Next, perform hand hygiene and change gloves prior to starting the dressing change. Open the dressing change kit. Do your best not to touch the insides of the kit, as you could contaminate the sterile site if not careful. Remember, there is a 1-inch border around our sterile site, so this allows you to touch any edge of the drape. The kit was designed to be used in a left or right direction. Use the pockets on the left and work your way to the right. The first thing you can do is to remove the mask and gloves and don them accordingly. Next, you will begin to removing the dressing with the detach-all. Make sure to break the capsule while it is inside the package, avoiding risk of cutting your hands on the plastic. When you remove the dressing, make sure to apply the detach-all at the removal edge, while pulling the dressing off low and slow. Low means you will pull the dressing back, remaining low, or as close to the skin as possible. And slow, well, slow means slow. Always try to remove the dressing from the outer edge towards the insertion site. This will prevent accidentally pulling out the catheter. If you do happen to pull out the catheter, do not push it back in, as the catheter is not considered sterile. There are biofilms secreted by microbes that can increase infection risk to your patient. The only time we'll push a catheter into the skin is at the time of insertion. Remember, if the catheter becomes withdrawn over 2 centimeters from insertion, the tip will have to be reevaluated with a chest x-ray. Remember to remove the catheter from the stat lock prior to removing the stat lock from the skin. This will allow you to minimize the risk of dislodgement. After moving the PICC from the stat lock, make sure to place it in a natural position, where it wants to lie without movement. This can help prevent the line from falling out if the patient shifts position. If the patient is not compliant and cannot remain relatively still, you might want to use the white tape in the kit to hold the line in place. If you do so, just remember it'll be harder to clean both sides of the PICC later on. When you have removed the stat lock, you now have the PICC bare to skin. This is the time you will want to clip the hair when appropriate. You can use a sterile 4x4 over the insertion site to prevent hair from dropping into the insertion. As our patient has no hair on her arm, we will move to the next step in cleaning the skin. Before we disinfect, we will apply CHG to clean skin. We used to clean the skin with alcohol swabs, but that required us to clean in concentric rings, moving away from the insertion site. Now, we use a tinted CHG stick, where we can use it in any direction. Make sure to clean the skin, removing the detach-all, and get under this PICC, and when necessary, both sides of the catheter. Before the next step, make certain the skin is dry. While waiting, you can clean your hands, prepare the sterile field, and don your sterile gloves. Remember that there is an alcohol gel in your kit to sanitize your hands and keep you from moving away from your sterile site. If you need custom-sized sterile gloves, make sure to collect them prior to the procedure. At this point, you will disinfect the area with a second CHG stick. This stick is clear, and we'll use it to remove the tint on the skin we applied earlier. You can use the sterile 4x4 gauze to secure the catheter. Again, direction does not matter. Disinfection should be applied for a minimum of 30 seconds. Please make sure to get both sides of the catheter, and note that CHG inhibits microbial growth for up to 48 hours after applying by binding to proteins on the skin. This is unlike alcohol, which has no lasting effect. Ensure ample dry time. This will take at least 30 seconds. Next, apply the liquid barrier to protect our patient's skin. Do not apply directly on the insertion site, staying at least 1 centimeter distance from it. Please note that Cavalon does not affect CHG efficacy. Make sure this dries completely before moving to the next step. Don't forget to measure the external length. You can use the paper ruler or just count the taps on the catheter. Also, make sure you use the centimeter side, not the inch side, if you use the paper ruler. Next step is securing the catheter with a new stat lock. You can use a new 4x4 gauze to hold the catheter while securing it. Make sure the blue pegs move freely and both adhesive tabs are on each side, not stuck together. Do not place the adhesive on the skin prior to clicking the line to the stat lock, as it can be very uncomfortable to the patients. When you adhere the stat lock on the skin, make sure you place a J-loop no greater than 30 degrees angle to prevent kinking. Also, you need to place the lines so it will all fall inside the transparent portion of the dressing. At this point, we will place the biopatch at the insertion site, ensuring 360 degrees circumferential coverage is in direct contact with the skin. Make certain the slit of the sponge is slightly off-center, approximately 20 degrees, to prevent the catheter from slipping between the slit. When placing the dressing, make sure that you don't stretch it, as it will cause micro tears on your patient's skin. This is the one time your OCD can get the best of you. Don't worry about any folds or seams. It doesn't need to be perfect. Use a plop and drop method, where you align the dressing, then drop it down with only one hand. Start from the inside of the catheter and apply pressure to activate the dressing. Remember that the transparent portion of the dressing should contain the entire biopatch and catheter. When placing the pants, make sure they're snug to the catheter. A good way to do this is to remove the backing from only half of the pants dressing. You can place it over the catheter, then lift the PICC up over the dressing and secure the second side of the pants under the catheter. Remove the second side of the pants. After the pants have been placed, label with initials, date and time, and you are done.